Okay, let me just share my screen. Thank you. Fiona, could you just tell me if you can see that screen? Fiona?
Yes.
Can you see that main screen?
Absolutely. Yeah.
Oh, cool. Sorry, there you are. Sorry, lost my video.
It was on mute.
Awesome. All right. Well, I just want to say welcome everyone, and thank you for joining us today for our webinar, providing you an update on the Health Canada approved HyQvia, a new immunoglobulin treatment for Canadians with immune deficiencies. Now that HyQvia is available to patients, Immunity Canada is pleased to offer informational webinars to our members across the country. We've already had ones in the Atlantic, the Prairies, and Ontario, and this is our last one today for BC. My name's David. I'm the programs manager and your host for today, and I'm joined by Fiona, our volunteer and project coordinator, who'll be providing background support. A very quick thank you to our sponsor, Takeda, today for helping us put on the event. And a very warm welcome to the over 60 people who have registered for this event this evening. I hope you're not all too hungry, because I know it's around dinner time for most people. And just to say that we're joining you here from our office in Victoria. And we just want to quickly acknowledge that from coast to coast to coast, we're all guests on the ancestral territory of Inuit, Métis, and First Nations people. Members are encouraged to consider their own position in relationship to the land where they find themselves, as part of improving our own understanding of local Indigenous people and their cultures in a spirit of reconciliation. And if this is the first time attending an Immunity Canada event, we empower Canadians impacted by immunodeficiency disorders to live well. And we're a member-based organisation that provides a strong voice for patients and their families. And we work with health professionals and others within the immunodeficiency community who help ensure everyone has access to the resources they need to thrive. A huge thank you today for our panelists joining us. Hopefully you can all see them at the top of your screen at the moment. We have Dr. Pourshahnazari, who is a member of the Division of Allergy and Clinical Immunology at St. Paul's Hospital, where she's co-director of the Primary Immunodeficiency Transition Clinic. She enjoys teaching and is a clinical instructor at UBC. Her clinical interests lie in the interplay between the human immune system and the external environment. Her practice focuses on the diagnosis and management of allergic and immunologic diseases in adolescents and adults. She also has the privilege of providing outreach services to beautiful Haida Gwaii, BC. I'm very jealous that you get to go there. And we're joined by Noor, who's a registered nurse managing a SCIG home infusion program at the Jim Patterson Outpatient Care and Surgery Centre in Surrey, BC. She has been involved in immune globulin therapy for immune deficiency patients for 10 years and truly enjoys working with them, striving to make a difference in their journey of their IG treatment. We're also joined by Canadian Blood Services Formulary Management Team. We have Andrew McLeod, who is the Manager of Stakeholder Engagement. And we're also joined by Vahid Hugugi, who is the Product Review Manager of the Formulary Management Team. Again, thank you all to joining us tonight, and thank you all to the panelists. And to give you a really quick overview of the next hour, after I finish talking, we'll go over to Persia, who'll give us the overview of HyQvia, and then to Noor to talk about transition and training. And then we'll spend most of the time answering questions that have been submitted or answer questions that get submitted live. Just to let you know that if you have any technical issues, Fiona is on hand, so you can put them in the Zoom chat. If you have any questions that come to mind, you can put them in the Zoom Q&A. And just to let everyone know that people who register for the event that can't make it, and yourselves, you'll all get a recording of today's session. Only the panelists and myself are going to be visible on the recording, and only the panelists and myself will see the questions coming in. A quick disclaimer, we offer these events developed by health professionals, our members and others who are invited to serve as presenters. The views and opinions expressed by guest speakers do not necessarily reflect the views and opinions of Immunology Canada. Information provided at events should not substitute advice from your physician or other qualified health providers regarding your medical condition. All right, and now it's time for the main event. And over to you, Dr. Pourshahnazari, to provide us the overview of HyQvia.
Thank you so much.
Thank you.
I can't share until you stop sharing.
Oh, sorry about that.
Well,
there you go.
thank you. So just let me know if you can't see my slides at all. So for those of you I don't know, I'm Dr. Persia Pourshahnazari. Everybody calls me Dr. P in my practice. I was just looking at the participants list, actually. I see a lot of my patients on there, so this is great. It's a really nice event to be able to sort of talk about a new treatment option that's available to everybody. And if you are one of my patients and you're interested in HyQvia or you want to talk about it more, just feel free to contact the office and book an appointment. But yeah, I think we're all on the immunology side really excited to have HyQvia available in Canada now, because it's just another option available, and more options are better. So we'll talk a little bit about what HyQvia actually is, in case you're not familiar with it yet. So essentially, HyQvia, it's human immunoglobulin. So, many of you are receiving subcutaneous immunoglobulin already, or intravenous immunoglobulin. It's the same idea. It's just a sort of different way of giving it. So with traditional or conventional sub-Q IG or SCIG, you're sort of doing a 20% product. You're putting in an amount that's sort of tolerable to the sub-Q tissue, and you're usually doing it once a week. Of course, there's variety in how that's done for folks, but generally it's kind of once a week. You've got a set volume that you do. With HyQvia, it's actually a 10% product. So, it's a less concentrated product, but you kind of make more space for it in the sub-Q tissue by infusing this human hyaluronidase first. And I'll talk about what hyaluronidase is and how that kind of works in a second. But with this product, what you kind of do is you make space, and you can put more of the sub-Q immunoglobulin in there. And so because of that, you can dose it either once a week, once every 3 weeks, or once every 4 weeks. So that does provide quite a bit of flexibility for patients in terms of, what it is that you're going to do with your infusions, how often you're actually going to do them. In Canada, it's indicated for adult patients with primary and secondary immune deficiencies. Comes in a variety of vial sizes, and Noor will talk a little bit about the logistics of infusions and that sort of stuff, so I won't go there. This can be self-administered by patients at home. So those of you who are already on conventional SCIG are probably doing that, or having a family member or a friend help out with your infusions. It's still not totally clear how this is going to pan out in BC, but there may be an option to have a healthcare provider administer HyQvia. So there may be the option of somebody coming to your home and doing it once a month kind of thing. I'm not sure about how it's going to work in healthcare facilities, or if that's going to be available, but these are things that are sort of getting looked at still. So what is this hyaluronin that has to get kind of, moved around so that there's a bit of space? It's also known as hyaluronic acid, and it's basically a sugar chain. It's kind of found around cells. So you can sort of think of it as like the jelly around all the cells. It takes up a lot of space, and it does cause resistance, and it limits the volume that can actually be put into the sub-Q site with conventional SCIG. So, if the jelly's all there and it's, pretty packed, there's not much space there. You can actually get something into the sub-Q tissue, and that's why you can't put an entire month's worth of conventional SCIG in there and sort of tolerate that. With the HyQvia, what you do is you infuse that hyaluronidase first. Methane ends in ASE means it's an enzyme. So this hyaluronidase will sort of chew up the hyaluronin. It'll get rid of that jelly around all the cells, and it'll make a big sort of space or a big pocket. And then you're able to put in more of that immunoglobulin product. And that's how you sort of get away with the once monthly dosing administration that's available with HyQvia. Who is HyQvia sort of meant for? So again, it is for adult patients. It's not indicated in pediatrics, and anybody with PID or SID who needs immunoglobulin replacement therapy. Folks who might find this particularly appealing, so people who are on IVIG, who do appreciate, only doing their infusions every 3 to 4 weeks. So if you're kind of the person who's like, oh, I don't really want to do infusions every single week, this might be a nice option. If you're on conventional sub-Q and you also don't want to do infusions every week, this might be an option. You could potentially do it every 3 to 4 weeks instead. If you're needle phobic and you don't want to keep poking yourself, or you want to reduce the number of pokes throughout the month, this is an idea as well. And if you, again, would like to be able to do the sub-Q route, but you just cannot administer it yourself, you don't have anyone around who could help you, there may be the option of assistance of a healthcare provider for this form. Who qualifies? Again, anyone over the age of 18 with primary or secondary immunodeficiency who needs immunoglobulin replacement. Just something to note, the study data for HyQvia, there weren't a ton of patients, actually only 7 patients who were over the age of 65. So limited data in folks over 65, but still an indication. There are certain people who are not eligible for HyQvia. So if you've ever had a history of an anaphylactic or a severe reaction to any immunoglobulin product, then that would sort of extend to this one. If you are known to be IgA deficient and you have anti-IgA antibodies, then there is a contraindication here. If you're already known to be allergic to hyaluronidase, then you don't want to be using hyaluronidase. And there are some other ingredients in the formulation, so specifically something called glycine, there's calcium chloride, there's EDTA disodium, and of course human albumin, which is just because we've all got. But if for whatever reason you're known to have bad reactions to these, then you're not supposed to use this formula. So essentially how it's done is you infuse that recombinant human hyaluronidase, the enzyme first, and that helps to open up the jelly and get rid of the sugar chains, make space. And then you infuse the 10% human normal immunoglobulin into the space afterwards. And because you have more space, you're able to do a larger volume infusion than with conventional SCIG. So all of these photos come from Takeda, but I think they're quite illustrative of kind of what this actually looks like for folks. So the big thing to know is that the infusion site swelling is temporary and it goes away within a few days. So those of you on conventional SCIG are probably used to some local injection site swelling. This is much larger because you're putting in quite a bit more volume. Typically that volume sort of stays kind of as a soft swelling for about 1 to 3 days. So if you can see here, you've got your patient, kind of how they looked before and then how they looked after the infusion. And then about 24 hours later, you can see the swelling has come down quite a bit, but it's still a bit swollen compared to before they did the infusion. And they've got pictures on the top there of the abdomen, and they've also got pictures on the bottom of where they infused into the legs. What you can sort of expect is, most of the swelling is going to be after the infusion's done, so right at the end of the infusion. And then over hours to days, the swelling sort of dissipates. They sort of recommend that you wear looser pants or clothing for those couple of days after the infusion. And probably one of the best descriptions I've heard, if you do it on the abdomen, you sort of get this pancake on your abdomen. That's kind of what it looks and feels like. Why would someone be prescribed HyQvia? So again, if you're someone who wants fewer infusions or fewer needle pokes throughout the month, this might be a nice option for you. If you do need the assistance of a healthcare provider to do sub-Q infusions, this may be an option as well. And then if you've actually had issues with other immunoglobulin replacement therapies, so you've had reactions to IVIG or you've had issues with conventional SCIG, this is just another alternative to try. No guarantees that you would tolerate HyQvia if you have trouble with the other ones, but again, it's another option, something else to consider. And then most importantly, patient preference. So you don't have to prove that you have a problem with something else to be able to access HyQvia. If there's a desire to give it a try, that's reason enough. So that's sort of my quick little overview about what it is. And then I believe Noor is gonna take us through kind of some of the logistical details next.
Awesome. Thank you so much for that. And Noor, I'm just gonna ask you to turn your camera on, and then let me just share your slides real quick. Okay. And hopefully, Noor, you'll get a message that says to
yes, I got it. Okay.
Go.
Okay, thank you. Oh, hi, good evening, everyone. So my name is Noor Zhu, for those of you who don't know me. I'm a registered nurse working for the Fraser Health SCRG Home Infusion Program at Jim Person Outpatient Care and Surgery Center. So tonight, I'm quite excited to talk to you about HyQvia transition and training. And thanks to Dr. Persia giving us, quite good information about HyQvia. David, I believe you will need to flip my.
Yep. If you give me a thumbs up, I'll keep flipping.
Okay, I'll give my index up. Okay. Okay. So HyQvia initiation process. So starting HyQvia, we are looking at 3 groups of patients. First groups patients starting immunoglobulin treatment anew, and we can start this group of patients at any time on HyQvia. So we will start from a weekly equivalent dose to a 3 to 4 week interval. And then next group of patients are those switching from IVIG. The HyQvia dose and frequency will be same as IVIG, and they can start HyQvia 1 to 2 weeks after last IVIG. And the third group of patients, sorry, will be switching from conventional SCIG. The dose will be adjusted based on weekly equivalents. So we can start HyQvia for this group of patients a week after the previous SCIG. Next slide, please. So HyQvia is best initiated by following a manufacturer recommended ramp-up schedule. And HyQvia is typically infused every 3 weeks or 4 weeks. So this is a chart for 3-week dosing regimen, how we ramp up for 3-week dosing. So week 1, first infusion is given 25% of total dose. And week 2, second infusion is given 50% of the total dose. And then we skip week 3, week 4, third infusion, we give 100%, followed by week 7, fourth infusion, another 100% of the total dose. And thereafter, continue the full dose every 3 weeks. Now, this is the 4-week dosing. Sorry, David, go up again. This is the 4-week dosing regimen ramp-up schedule. So week 1, we give 25% of total dose. Week 2, 50%. Week 4, the third infusion, we give 75%. And then 3 weeks after, at week 7, we give 100% of the total dose, and thereafter continue the full dose every 4 weeks. Next. So these are the available HyQvia vial sizes. They come in 2.5 gram, 5 gram, 10 gram, 20 gram, and 30 grams. So each unit contains two vials. It's a dual vial unit. So each unit contains vial of 10% Ig and a smaller vial of hyaluronidase. Next slide, please. So how we store HyQvia and how we handle. So HyQvia has a shelf life of 3 years from the date of manufacture. And it is to be stored at a fridge at 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit. But you can also store at room temperature up to 25 degrees Celsius for 3 months. But if HyQvia vial has warmed up to room temperature, then it should not be returned to the refrigerator. Keep at room temperature. It is very important to bring HyQvia to room temperature before infusion. Do not use any heating devices like a microwave or hot water. It is recommended to take the product out of fridge a night before infusion. To bring up HyQvia to room temperature is very, very important. This will help prevent air bubbles, prevent pump alarming. It will also help with product absorption. And then the vials should not be shaken. So keep the vials in the original carton box to protect from light. So now what are the supplies for HyQvia? So we use this electronic pump. The brand name is called Eaton Sci-Fi pump. So it is perostatic, portable, lightweight, very much like the ones used in the hospital, but it's pretty neat, portable. And it comes with a mini cradle, power supply, a pole. The mini cradle supports the pump on a pole. And once we enroll our patients into OnePass program, the program will arrange and send the pump to the patient ahead of training. And then we got other supplies. So we will have our HyQvia vials ready at room temperature. We have a HyQvia infusion mat, and then an infusion tubing, and 10 to 630 ml syringe for hyaluronidase, and of course a sub-Q needle set, and drawing needle, gauze, tape, and echo swabs. And the needles for HyQvia. So there are 3 types of needles used for HyQvia infusion. They are gauge 24 and 26, either single or double line. So the one on the left, this is soft glide gauge 24. It comes in 9 millimeter and 12 millimeter in length. So this needle actually is used by our current SCIG patients, but most of our patients use a smaller gauge 27. And the needle in the middle is called OptoFlow. OptoFlow sub-Q gauge is 26. It comes in 9, 12, and 14 millimeter in length. And the one on the right is high-flow sub-Q needle, gauge 24. This comes in 14 millimeter length. Infusion sites, so where we infuse HyQvia. So this is a little bit different from the current SCIG. So we will be using mid to upper abdomen and upper thighs. And if 2 sites are used, we will pick contralateral sides of the body. And then we will have to avoid blood vessels, scars, tattoos, inflamed or infected tissue. and avoid bony prominences, such as rib cage and hip bone. And we will have to make sure that the area has got enough fat tissue. And we will keep 4 inches away from if two sides are used, don't put two sides too close. This is pretty same as what we do for one of the current SCIG curvature. We also advise our patients to keep 4 inches apart. And for Hizentra, 2 inches apart. And we also have to make sure that the sides are away from the navel for at least 2 inches. And if we can, then we try to rotate infusion sites with each infusion. So how do we administer HyQvia? So first we will choose a flat area, then clean the area, and then we'll get the supplies. And then of course we'll wash hands, and then we'll inspect both HyQvia and hyaluronidase vials for clarity, color, and integrity of the vial. HyQvia vials will be same as our current SCIG. It will look either colorless or pale yellow, but hyaluronidase vial will look clear and colorless. So next step is to draw all hyaluronidase into one syringe, or then attach to a sub-Q needle, and then we'll prime the needle. And then once hyaluronidase is prepared into a syringe, now we will prepare HyQvia. So we will spike the infusion tubing into HyQvia vial, and then we will prime the tubing by using the pump. And then we will set up tubing in the pump, and then we will also prepare the pump setting. And then once both hyaluronidase and HyQvia are ready, then we will insert sub-Q needles into either abdomen or thigh. And then we'll start to infuse hyaluronidase first at 1 to 2 ml per minute per site by manual push. And then we will start HyQvia within 10 minutes of hyaluronidase infusion. So it is very important to start HyQvia within 10 minutes of hyaluronidase infusion. Okay, next slide, please. Hello, David.
Sorry, no, my mouse has fallen asleep for some reason.
Okay.
Bear with me a second.
All right. Okay, is your mouse okay?
Sorry about this, Noor.
Okay, that's
Always
okay.
the first time for everything, huh?
Yes.
Right, let me just... I'm gonna have to stop sharing that for a second. Sorry, everybody. Let me... Sorry, Noor, do you want to try and just share your screen again? Because I know
Yeah,
you've got...
try. I will.
Sorry about this.
I will.
Oh.
Can you see, David?
I can see your slide. Yeah. Sorry
Okay,
about
I will
that.
see now if I can flip. Can you see my screen?
I can't. You know what? I think
Yeah,
I'm
that's a
going to
problem.
be. Let me try that. Let me try going back to your screen a sec.
Or otherwise, I can flip to the slides, which have not been shown yet.
Yeah. Do you want to?
It's okay. I will share this screen. Can you see this screen? Okay, 1 second. I will share here.
Sorry about this, everybody.
Can you can everyone see this screen?
Yeah, I think that's fine.
Can you?
That's totally fine. Yeah, we've
Okay,
had a
sorry, we will be a little bit slow, but I can still work. So that's okay. So this is my next slide. This is the HyQvia infusion rate. This is a manufacturer recommended infusion rate. So for patients less than 40 kilogram, the first two initial infusions, infusion rate at 10-minute interval, 5, 10, 20, 40, and 40. And sorry, 40 and 80 ml per hour per infusion site. And for the infusion 3 and more, the rate will be 10, 20, 40, 80, and 160. Now for patients greater than or equal to 40 kilograms, the recommended infusion rate for the first two infusions at 10-minute interval, 10, 30, 60, 120, and 240. And the infusion 3 and more at 10 minutes interval, it will be 10, 30, 120, 240, and 300. The maximum infusion for patients less than 40 kilograms, 300 ml per site. And for patients greater than and 40, greater than or equal to 40 kilograms, will be 600 ml per site. So that's pretty, pretty large amount can be accommodated. Okay, can you all see my next slide? David, can you see? Hello?
Yeah, I can. Oh,
Can you see my next slide?
so I'm having some. I can see that. Yeah, that's fine. Yeah.
You can. This is a new slide to you, right?
Yeah, and the audience
Okay.
can see it.
So sounds good. So we have ways to maximize HyQvia infusion comfort. So first, we encourage our patients to hydrate well a day before, during, and after infusion. This is same as we do for our current conventional SCIG. And next, we also encourage our patients to have a balanced meal before infusion. This will help keep your body ready for the infusion, and after infusion as well, to have a good meal. And then it's also good to find a comfortable place in your home for the infusion. This will help you to relax. And we may also apply cool packs during hyaluronidase infusion and early stages of HyQvia to help minimize inflammation and discomfort. And the other strategies are you can get up and move around to prevent stiffness, encourage lymph flow, and also it will help with better product absorption. And then rest well after the infusion. Don't overdo it with activity, running on treadmill or weightlifting. So this strenuous exercise or activities to be avoided. And then lastly, we can apply a heating pad at infusion sites as needed. This will also help with the absorption of HyQvia. Okay, so this brings to the end of my presentation. Thank you so much, and everyone, sorry for the technical difficulties.
Yeah. You know, we practiced, and I'm sorry, I don't know what happened on my end there, but Noor and Persia, thank you so much for your presentations. And what we're going to do now is, I know we've had a few questions come in from the audience, and we've had some submitted already. But could I just ask Andrew and Vahi, could you just turn your videos on? And I just wanted you to just explain how you've been involved in the process. Yeah. Oh, there we go.
Sorry, I'm trying to turn it on, but it says that it's you have stopped the camera, so I'm trying to.
Oh, interesting. Okay, let me try this. Hopefully that'll work. Nice.
Okay, perfect. So do you see me now?
Yeah.
Okay, so basically, as you said, my role is I'm a product review manager, and my role involves collaborating with the Canadian Agency for Drug and Technology in Health, which is called CADTH, to review different products that they are plasma derived, such as like HyQvia. Also, I've been involved in overseeing the implementation and ensuring the availability of the product for ordering through the blood banks or transfusion medicine laboratories. And Andrew, over to you if you want to answer that.
Well, just to say that through that process, we seek to engage stakeholders in asking for their input on considering a product like this. And so that's where I work with Vahid and others to gather that input from groups like Immunity Canada.
Awesome, thank you. And we had one question come in saying, like, why is donating plasma important? I was wondering.
Yeah, it's a really good question. So basically, plasma carries various components crucial for bodily functions. Plasma is a crucial component in many medical treatment and therapies. It's used to create the life-saving medications for patients with various medical conditions, including immune deficiencies, hemophilia, or certain neurological disorder. So plasma donation also contribute to the medical research and the development of the new treatments, and researchers use the plasma to study disease, test medication, and make advancement in medical science. The most important part of the usage of the plasma is for trauma and emergency care. So it plays the vital role in treating severe burns, shock, and other life-threatening conditions. So as you know, and I think many Canadian knows, it's really important donating plasma as it protects against any possible future shortage. By collecting more of the plasma, we use it for PPRP here in Canada, basically.
Awesome, thank you. Yeah, so we've had a few other questions come in. So one is, and I'll just float the question out, and Persia and Noor, you can decide between you how best to answer. I went to weekly infusions as the good effects were not lasting the month when I was getting once a month treatments at our local hospital. What would my chances be of this working better?
Yeah, it's I think your odds are pretty good with the HyQvia. So part of that is just when you know what the absorption kind of looks like between IVIG, conventional SCIG, and then the HyQvia, which is called facilitated SCIG. So with IVIG, you get a big bolus. So you get a whole bunch of immunoglobulin at the beginning of the month, and then it kind of like drops pretty quick. So by the end of the 4 weeks, you're sort of back to where you started. So it's this big up and then a big down. With conventional subQs with a weekly, it's really steady state. So, you get maybe a little tiny bump when you do the first infusion, but for the most part, your IG level is pretty solid. HyQvia is something in between that. So you do still get like a bit of a peak at the beginning, and it does wane over the month, but it's not as dramatic as the IVIG. So, if you are really susceptible to that kind of peak and trough effect, then maybe you get away with the every 3-week infusions with HyQvia. You might not make it quite to the 4 weeks, but you can certainly try it out and see if it works for you. But it's not quite as steady as conventional is. So that's a very, very good point. It is different that way.
No, did you want to add anything?
Well, yeah, I agree with Dr. Persia. So HyQvia is basically in between SCIG, the current, conventional SCIG and IVIG. So yeah, so the level will be in between the both. Yeah, we will see. We already had 2 patients started, so we will wait and hear from patients.
Another question. How does HyQvia compare to Savitru in terms of its production, composition, additives, preservatives, etc.? I understand that it is a different concentration, but is it otherwise comparable?
Yeah, I saw that question. I was actually just looking at the product monographs, and it looks like Cuvitru is really just glycine, water for injection, and then immunoglobulin. So there's not a whole lot in Cuvitru. The glycine is the buffer that's used in HyQvia as well, but Cuvitru specifically has no preservatives. So that EDTA, the other sort of stuff that's in the HyQvia doesn't look like it's in Cuvitru. How that actually translates clinically, like patient to patient, I don't know. I think we'll have to gain that clinical experience.
What is the max time permitted to infuse? Yes. Question from Noah.
Usually it takes 2 to 3 hours to infuse because hyaluronidase allows us to really infuse pretty fast. So I did try on 2 patients. One of them could really go pretty fast, like 600 ml, the max. He reached max for the first 3 infusions. The fourth one was a full dose, so the rate was a bit reduced to 450 ml per 2 sites per hour. So yeah, typically pretty fast, but once the virus spiked, I believe all blood products, of course, has to be, infused as soon as possible. So I don't know exact time. I'm guessing around probably to be infused in 4 hours, I think. Not 100% sure, but yeah, typical infusion time is between 2 to 3 hours.
Thank you. And could I take this when I have a huge hernia for my LGL leukemia surgery?
I imagine you wouldn't want to do the abdomen. Is that right?
Yes, I think,
do
yeah, you can do thighs. Thighs works pretty well as long as you have, enough subcutaneous tissue. Yes, definitely. Especially if your dose is not too high. So yeah.
And next question is, the benefit for me from SCIG has been steady IgG rates, no highs and lows like I had from IVIG. How did this product do in trial? Did patients experience the feelings of highs and lows that are common in IVIG?
So in terms of how it did in trials, the prevention from infection is pretty much equivalent. So it really, it wasn't superior and it wasn't inferior. It looks like it works well, just like the other products do. You do get the highs and the lows, but it's not nearly as much as you see with IVIG. So it truly is something right in between IVIG and conventional subQ.
No, did you want to add anything there, or?
Yeah, I think so. It's in between 2 products. So if you really want very steady, level, you may stay on weekly, the current SCIG, I would say.
Does the new pump have a battery backup?
So the new pump, before its initial use, has to be charged. I don't remember hours. I think six or 8 hours. And then depends on infusion rate. If you run very fast, you may have to, keep it plugged in. But there's no battery backup as far as I know. But the pump will be on loan. One Pass program will provide pump support. So whenever there's problem, you can contact One Pass program. So they will provide the solution for the pump. Mhm.
Can we use the same supplies and pump we use for Savitru?
So some are same. I mean, the gauze, tape, the X swab. The difference is the IV tubing. So we need a special microball IV tubing for infusing HyQvia, which fits into the pump. And in terms of sub-Q needle, so now HyQvia needs a bit bigger needle, so either gauge 24 or 26. So most of our patients use gauge 27. This will not work for HyQvia.
One question was, is it possible to do more doses, like maybe 2 times per week or more often?
So HyQvia is designed for less, infusion frequency, right? So if you want to do more, and then we should stay on, conventional SCIG, which can be breaking down to every other day, or 3 times a week, or weekly, or up to every 2 weeks.
Yeah, I agree entirely. I think the point of the benefit of HyQvia would be lost in that case.
Right.
Much better to stick to conventional SPIG.
Right.
And we had a question, what volume would be equivalent to 40 cc of Savitru?
40 cc Savitru. So if it's weekly, and then which means 8 gram, right? So 8 gram monthly will be 32. So the volume will be 320 ml per month. So we typically use 2 sites. So each site will be receiving 160 ml, which is a fairly normal dose. We had a patient, one of my recently trained patient, his dose is 45 grams, so 450. And so far he tolerated fine.
Thank you. How long afterward should you wait before using another sub-Q product like insulin in the same area?
I usually advise my patients not to infuse on same day, but insulin, yes, insulin is given daily. You cannot avoid. That's okay. Insulin, as long as stay away from the IG infusion site. In terms of other, sub-Q infusions like biologics, I advise my patients just don't do it on same day, just for comfort, for possible, monitoring of side effects. There's not really real contraindication in doing both on same day, but I think for patient comfort.
Thank you, Nora. Is it possible to do a trial of just the hyaluronic acid to test for reaction?
I don't know, Dr. Persia, you want to answer?
No idea. I'm sorry. Yeah, because it's a dual vial kit, right? Like you can't really just get the hyaluronidase on its own, can you? I mean, I guess you do a manual pump with the hyaluronidase, but I don't know if that, wastes the entire kit or not.
And then how we test it, right? So
yeah, I would imagine just do like a small, like a 10% manual push and see if they have any trouble. But it might mean wasting an entire kit to do that. I'm not sure that would be sort of really feasible.
Yeah. Another question we had in, I understand the pump is electric. Is it possible to pause it, or does it need to be turned off and on like I do with the Verserate.
Verserate. So pump can be it's a multi-therapy pump. Once you're trained, you can actually program into your different infusion rate. The pump will automatically, do the infusion based on whatever rate you set. So you can set up multiple infusion parameters inside. So yeah, so it's different. It's totally different from the one we use for conventional SCIG.
Thank you. How do you determine if the frequency is at 3 or 4 week intervals?
Part of that is your experience. Let's say you start at the 4-week interval and then you feel like it's not quite working or you're having trouble. Then you may want to drop it down to 3 weeks. Yeah, I think it would really be your personal experience and how it sort of progresses.
Thank you.
And I believe it can be adjusted, right, Dr. Persia, based on individual patients' needs, right?
Yeah, absolutely.
Yeah.
And what is the difference between this product and other subcutaneous products like Hizentra, for example?
Yeah, the big difference really is the hyaluronidase. So you're getting that space. And then when you have the space, you can put in essentially an entire month's worth of product all at once.
Mm-hmm.
So the frequency of infusions, fewer needle pokes, and then there is that pharmacokinetic difference. So you don't get quite the steady state. You do get not quite the big ups and downs with IVIG, but maybe something in the middle. And then it is a 10% immunoglobulin product. It's not the 20% that both Cuvitru and Hizentra are. So that's just another difference in the formulation as well.
Thank you. And next question is, have there been any side effects reported?
Yeah, predominantly local. So similar to conventional SCIG, which is also predominantly local, you get the infusion site swelling, you can get infusion site reactions. With this one, there's significantly more swelling than there is with conventional SCIG, and it takes a few days to go down. So that's sort of one of the biggest ones. It does not have as many full body side effects that you see with IVIG. So it has that benefit still similar to conventional SCIG. The very, very rare severe side effects, they're still very, very rare with this product as well.
No, did you want to add anything or?
Yes, so based on my recent experience with my 2 patients, so they follow the manufacturer recommended ramp-up schedule and infusion rate. So they both worked out at their own preferred best location for infusion and number of infusion sites and the rate. So what I noticed is infusion site for one patient, she does not really have much infusion site problem. So during infusion, I didn't notice the sites are pretty red, but somehow towards the end of infusion, the redness just gone. So and the other patient who's on a bigger dose, his infusion site during infusion also was pretty minimal. But he did say next day was more prominent, kind of stayed for, I believe, about 2 days. So again, not a huge issue, but he also complained when we reached the 45, the 100% dose. He did feel a bit pain, 3 out of 10, but he was running a bit fast. I did suggest to go down, to slow down, but he said no, he had to go. His friends waiting to pick him up. So we did stay at 480 ml per 2 sites per hour, but he did tolerate. Yeah. So generally, I mean, systemic reactions, no. For the patient who receives a bigger dose, he did not complain anything. But my other patient, she did have a bit of systemic reactions, dizziness, feeling kind of a bit, uncomfortable. So we reduced her dose to 100 ml So she is very comfortable at 100 ml per 2 sites per hour. And she actually did not tolerate IVIG, did not tolerate Hizentra, did not tolerate Curvitru well. So HyQvia, as far as I know at this moment, looks like it's the best fit for her. So yeah, they both had the first training last week. So this patient is on 3-week schedule. She has completed training. She will be starting her infusion in 3 weeks at home. So yeah, everybody's different, but so far mostly local infusion.
And kind of a similar question, really. Like, what if I have unusual side effects? Are there any that mean I should stop taking HyQvia?
That's what allergic reaction, I would say, right? So unusual, so we have to stop. Or any,
Yeah, if you got any severe side
Yeah.
effects, then obviously that would be sort of a reason to stop as well.
Yeah.
Yeah,
I would say like these 2 patients are very good examples. So the patient who is on high dose, he's new to IG replacement therapy. He was first prescribed weekly, and then I called her. He said, no, I don't want to do weekly. I already have other 2 sub-Q injection going on, and he also does not want to go monthly IVIG. And then that's the time HyQvia, became available. So I told the prescriber. So yeah. So I believe this is also a good fit for him for his life goal. He wants to do, monthly instead of weekly.
And got time probably for just one more question. And I'm currently infusing 22 grams of, and so I can never say this, sorry, Kutaquig every week over about 60 to 70 hours. Would I be able to transfer to HyQvia at what dose? Quite a specific one, but. So if using 22 grams of Kutaquig every week over about 60 to 70 hours, would I be able to transfer to HyQvia, and at what dose?
Well, I don't understand how come 60 to 70 hours, minutes probably.
Yeah, maybe.
No, it's hours.
Oh, sorry.
It's
Hours?
really like severe side effects, that sort of thing. So an 88-gram dose a month, is that sort of doable more?
88 a month.
Mm-hmm.
That's huge.
It's huge, yeah.
Yeah. I don't know, 880 ml. So if we want to do it, then we'll have to do more than 2 sites.
Probably like maybe even every 2 weeks.
Oh yeah, we can reduce. Yes.
Yeah.
Yes, we can do more frequently. Exactly. Yes.
Yeah. So I think it would be doable if you did every 2 weeks.
Right.
Well, thank you so much for answering so many questions in such a short space of time. Can you all see that slide? And there are a few questions that we didn't get to, but perhaps maybe I might send them to you, Persia and Noor. And there's not that many, so I promise. And so hopefully we'll be able to get at least a written response for those ones. And sorry so much about that technical difficulty on my end. They say never work with kids or animals, but I also say computers. But I just want to say a huge thank you for everyone who attended this evening. A huge thank you to all of our presenters and panelists. And again to Takeda, who sponsored this event. And just to let you know that we will be following up with all of you and those who couldn't make it today with a recording and a quick survey to see how we can improve our events. And hopefully some responses to the questions we didn't get to today. And just to do some publicity, self-promotion for Immunity Canada. If you're not a member and you'd like to be, it's free and you can sign up on the website. If you're a patient or a family member or a health professional, you can all become a member. For non-members and members alike, you can sign up to our monthly newsletter and direct emails to know what's going on around everything in your community. And And if you are new or you are a patient or family member, we have started a community connect group, so they're worth joining, so you can meet more people, new people in your province and nationally. And yeah, again, a huge thank you to all of you for taking part as panelists tonight, and yeah, see you at the next event. Awesome. Bye, everybody.
Bye, everyone.
you.
Thank you.
Thank you.
Bye.